Dr. Scott Haldeman is a clinician, researcher, and scientist, author, leader, educator, advocate, philanthropist, and pioneer in the fields of chiropractic, complementary medicine, neurology, and the interdisciplinary care of people with spinal disorders. Low back and neck pain has been determined to be the #1 cause of disability globally. These conditions have a greater burden of disease than HIV and AIDS, malaria, Alzheimer's disease, lung cancer, or breast cancer. Over 1 billion people in the world are disabled, and the major cause of this disability is musculoskeletal disorders, and specifically low back and neck pain. Disability disproportionately impacts women, the elderly, rural communities, and the lowest economic quintile of the population. Despite this burden of spine disease, there has not been any consensus on how spine pain should be managed, and considerable disagreement on the role that chiropractic and complementary medicine should play in the management of this crisis. Dr. Scott Haldeman has spent 45 years trying to address these problems. As a pioneer, he was the first chiropractor to obtain a Ph.D. degree in biological science and the first chiropractor to obtain an M.D. degree and to specialize in neurology. He helped organize the U.S. National Institutes of Health study on spinal manipulative therapy. He chaired the commission to produce guidelines for chiropractic quality assurance and practice parameters, the first attempt by any complementary healthcare profession to set standards of care for itself. Dr. Haldeman practiced as a chiropractor for 10 years and as a board-certified neurologist for 35 years. He worked within a university medical hospital, Veterans Administration Hospital, and in private practice. Dr. Haldeman conducted basic science research on the impact of peripheral nerve compression and early research on glutamate as a synaptic transmitter in the sensory pathways in the brain. He developed new testing methods for the diagnosis of neurologic disorders affecting bowel and bladder functions, and did extensive work on electrodiagnostic testing of spinal nerve and spinal cord function. He has chaired or served on multiple task forces to review the scientific evidence of the various treatment options for the management of low back and neck pain, and to establish clinical guidelines for clinicians who treat patients with these problems. As an author, Dr. Haldeman edited 3 editions of the most widely used textbooks in the chiropractic profession. He has authored or edited multiple additional textbooks and journal supplements on spinal pathology and pain that are widely used by medical and other professionals who manage spinal disorders. He has authored and co-authored over 230 peer-reviewed scientific articles and book chapters. As a leader, Dr. Haldeman has been elected president of the North American Spine Society, the American Back Society, and the North American Academy of Manipulative Medicine. He served as founder and chairman of the Research Council of the World Federation of Chiropractic. Dr. Haldeman was president of the Bone and Joint Decade 2000 to 2010 Task Force on Neck Pain and Associated Disorders. He is currently chair of the Global Spine Care Initiative, a multidisciplinary task force of 68 spine care clinicians and researchers from 24 countries. The goals are to develop and evaluate an innovative, integrated model of care to improve the management of spinal disorders and to reduce the associated global disability and burden of disease. As an educator, Dr. Haldeman has appointments as clinical or adjunct professor at 4 universities in the USA and Canada. He has lectured at multiple educational conferences in over 28 countries on all 5 continents. As an advocate for the inclusion of evidence-based chiropractic and complementary healthcare, Dr. Haldeman has been asked to provide testimony or act as a consultant for the U.S. Department of Defense and Veterans Administration, as well as commissions of inquiry in New Zealand and Australia. Dr. Haldeman and his wife Joan founded the World Spine Care charity, registered in the United States, Canada, and the United Kingdom. The mission: to improve lives in underserved communities and to create a world in which everyone has access to the highest quality spine care possible. World Spine Care has established 6 clinics providing care for spinal disorders in 4 countries: Botswana, India, Dominican Republic, and Ghana. It has provided care to over 40,000 patient encounters to date. World Spine Care provides training for local clinicians in the countries where the clinics are located through conferences, scholarships, and surgical fellowships to ensure sustainability of the program. Over 700 clinicians in the countries where the clinics are located have attended conferences. Dr. Haldeman has made a groundbreaking difference in the management of patients disabled by spinal pain and associated disorders, as well as our understanding of chiropractic and complementary health care. These achievements, however, could not have occurred without the support of his wife, Joan, physical therapist, co-founder of World Spine Care, and supporter of everything Dr. Haldeman has done. In addition, Dr. Haldeman's gratitude goes to the vast team of mentors, students, collaborators, colleagues, and supporters from around the world.
Well, good morning, everybody, and welcome to this Fireside Chat with Dr. Haldeman. I'm Nathan Cashin. I'm the Director of Communications for World Spine Care. And the video you just saw was produced by the Foundation for Chiropractic Progress as a tribute when Dr. Haldeman received the Sheikh Zayed International Award for Traditional Complementary and Alternative Medicine in 2020. We do want to acknowledge that today is Veterans Day, or Armistice or Remembrance Day in many parts of the world, and it is a day to observe and honor military veterans, both in the United States and other countries. So we thank members of the armed forces for their service and sacrifice, and we thank you for joining us on this observed holiday. Because of this, a recording of the event will be provided to all registrants who might be unable to join us today. Briefly, our agenda for today is to begin with some introductions as well, and follow that with a discussion led by Dr. Reed Phillips, discussing Dr. Haldeman's career. And then we'll go into a Q&A, and we have received quite a few questions during the registration process. You may be able to enter some Q&A in the Zoom Q&A feature, although we may not be able to get to most of these questions today. It'll depend on some time. We might be able to go a little bit over the allotted time today, but we will find a way to respond to as many of these questions as we will. And then at the end, we do have a copy of Dr. Haldeman's biography, which is written by Dr. Phillips, to give away to a random attendee of this webinar. So we'll do a brief raffle, and then we will find a way to get that out to everybody. I'd like to introduce our guests today. Dr. Scott Haldeman is a graduate of the University of Pretoria, South Africa, the Palmer College of Chiropractic in the USA, and the University of British Columbia Medical School in Canada. He completed his residency in neurology at the University of California Irvine and a fellowship in electrodiagnosis at the Long Beach Veterans Hospital. He has previously served as president of the North American Spine Society, the American Back Society, and the North American Academy of Manipulative Therapy, as well as on the Executive Council of the International Society for the Study of the Lumbar Spine. He has published over 240 articles or book chapters and has authored or edited 8 textbooks, and he is the founder and currently serves as president of World Spine Care and chairs the Global Spine Care Initiative. Dr. Reed Phillips graduated from the National College of Chiropractic in 1973. He was persuaded to then extend his Chicagoland experience and complete a radiology diplomate program. During his 11 years in private practice in Salt Lake City, Utah, he completed a Master of Science in Community Medicine at the University of Utah, followed by a Ph.D. in Medical Sociology. He moved with his wife, Sandra, and their family of 8 children to head the research department of the Los Angeles College of Chiropractic. After 4 years, he then became president of the Southern California University of Health Sciences, a position that he held for 17 years. Currently, he's the executive director of the NCMIC Foundation, and he is widely published as a researcher as well as a chiropractic historian. His previous chiropractic books include a biography titled Joseph Jancy, The Apostle of Chiropractic Education, and a book called The Global Advanced Chiropractic, which is about the World Federation of Chiropractic. He also published The Journey of Scott Haldeman, a biography of Dr. Haldeman, a spine care specialist and researcher, and he's currently writing a historical novel from a chiropractic perspective about healthcare since the Civil War. And again, stay tuned till the end of this webinar for an opportunity to gain a copy of that biography. Without further ado, I'd like to ask you to join me in welcoming our guests, and I'll turn it over to Dr. Reed Phillips.
Thank you, Nathan. Just a note, that book is going to become a valuable commodity because there's not many available. So it's worth waiting for to try and get it. Don't
And
mind if
that's
I
where
push
this one
my
came
own
from.
book,
I
but
saw there were only a couple left on Amazon, so I grabbed one. I don't know if there's many others floating around.
no, it's
So,
not been reprinted, and so you have to find one where someone else already has it, and I want to give it up. It's an honor to be here with Scott. We've been friends and fellow colleagues for many years. It's Scott's example and advice that led me to go into a research career, and I've been on his coattails ever since. And it's been a wonderful ride, and I've appreciated what he has done for the profession. So my job is to get Scott to talk about himself. And the first thing I need to do is ask some questions and let Scott run with it from there. So Scott, my first question to you is, there have been many chiropractors who have obtained either a Ph.D. or an M.D. And once attaining those degrees, they've never looked back. They've never given any credence to their origins as being a chiropractor. They've gone off and practiced medicine, and the profession, the chiropractic profession, loses track of these people. How did you manage to keep your feet in multiple disciplines at the same time? Chiropractic, medicine, neurology, research, quite an accomplishment. How did you do that?
Thanks, Reed. I first want to make sure we remember and thank the veterans, and we all pray and hope for world peace, especially these tumultuous times. Getting back to your question, it's a difficult question. I think when I graduated as a chiropractor, I was very young, and I got into practice with my father, and I found I really enjoyed taking care of patients. And I think that's a first requirement if you're going to stay involved in healthcare or healthcare research, is you have to enjoy working with patients. And then I found that patients enjoyed working with me. They kept coming back. They kept telling me they were feeling better and that they were benefiting from the treatment. And then I realized quite rapidly that I really didn't know what I was doing. I was doing what I was taught to do, and I presumably was doing it reasonably well. But I really didn't know why I was doing it or exactly what was happening. I'd been taught the classic chiropractic theories and background. And so went forward and did my bachelor's degree and did my master's degree. And the master's degree was in the field of nerve compression. And what was interesting in that time frame is that I found that there was a real camaraderie in the research community and even in the clinical communities, despite the antagonism to chiropractors. One of my father's best friends was head of neurosurgery at the university, and he would invite me into the operating room, and I'd scrub along with everybody else. And here I'm just a local chiropractor who happens to be doing a bachelor's or master's degree. And one time he had this patient with a fracture dislocation of the spine, and he took his calipers and he grabbed the two vertebrae, pulled them apart, and put them back together again and said, "How's that for an adjustment?" And then when I did my master's degree and published on nerve compression, I got this call from Bjorn Riedevik, who has become a national friend. He's an orthopedic surgeon who is doing his fellowship on nerve compression at the spine at University of San Diego, and we've become personal and close friends for many years. So there was this collaborative interaction between different professions and scientists who worked together very early in my career. And I think that was one of the major things. When I went on to do my PhD, in Canada, and then did medical medicine. I found that although there was a lot of disagreement and a lot of animosity between chiropractors and the mainstream medical profession, within the community I practiced, there was a lot of interaction. As a matter of fact, I was brought into medical school. I got early admission, special admission, because I had a chiropractic degree. And then, when I got into my fellowship, eventually into the fellowship as a neurologist, which was a natural evolution since I had a Ph.D. in neurophysiology. That was actually achieved because the University of California Irvine, that used to be an osteopathic school, had a foundation to study spinal manipulation. And so I got this invitation to come down from Vancouver and to help them, because they didn't know what they were doing. They didn't have anybody with an expertise in spinal manipulation, and especially somebody who had neurophysiology as a background that could help them participate. And I arrived here, and they said, "What specialty do you want to study?" And I picked neurology, and had a lot of support from the neurology department. As a matter of fact, within the neurology department, we started having symposia on spinal manipulation. So it was just a natural evolution that I've never, although there's been a lot of conflict, and I had to often stand up for things I felt were correct, I've never felt there's been a real animosity personally between myself and others. And I've always found a close affinity with chiropractors, acupuncturists, orthopedic surgeons, neurosurgeons, and I felt that we could work together once the barriers were broken down.
Following up on that, Scott, you started your research career when you were very young, 25 about, when you finished your DC and then your master's degree at University of Pretoria in South Africa. Give our listeners a historical perspective on how research in chiropractic has changed from that point in time when you started.
Yeah, that's not hard to talk about. The original theories of chiropractic were speculative theories. They are based on some anatomical study, observations. There had been some research within chiropractic, very little. There were no full-time researchers within the chiropractic world. As I noted earlier, I was the first person, a chiropractor, to get a Ph.D. in a biological science. And so when we looked at things, as I said, when I started research, I started looking at the things I had studied at chiropractic. I wasn't yet a medical physician, so it was a logical thing to do and look at nerve compression and nerve neural complaints that affect various body organs. And it just evolved into a situation that once the NINCDS program, the Institute of Neurological Diseases and Stroke, in the 70s, I think it was 75, it was developed. This is the US government put funds aside to look into spinal manipulation. And I was in medical school at the time, and I was being flown to Bethesda periodically to sit on this committee to establish this conference. And that conference basically stood up and said, at the time, there was no scientific evidence to support or reject the practice of spinal manipulation. In other words, it didn't matter which side of the argument you were. You can't argue from a scientific point of view because there was no science. Nobody had studied spinal manipulation. So although the chiropractors could not make claims based on any science, the medical critics could not make any, had no science on which to base their criticism, except to say there was no science. And there was no science for most medical treatments for back pain anyway. There were virtually no randomized controlled trials in the entire medical world for any treatment that was classically given to people with spinal problems. So it was very interesting. And then after that, we had this growth of chiropractors who began entering PhDs. You were one of them, of course. And there were numerous others, David Cassidy, Pierre Cote, and then gradually it increased, and the chiropractors were entering mainstream universities with their PhDs and doing mainstream research. We have, there are now 100 to 150 chiropractors who have PhDs around the world who are doing some outstanding work. They are getting scholarships from the major spine societies. They are presenting at every major meeting around the world. It doesn't mean we've discovered all the knowledge we have, but there's a tremendous amount of research being done. It's actually difficult now to keep up with not just the research on spine. We have hundreds of randomized controlled trials on different treatments for spinal pain, for example, and back pain and neck pain. But we also have a lot of biomechanical research, neurophysiological research, which is starting to look at some of the theories. But we still don't have all the answers, and that's something we could maybe talk about later. But I think that we're going to that the world of science, of the scientific world, the researchers have now got a body of people. They don't always agree with each other. There have been some serious conflicts, which is we would anticipate and actually hope for. If the scientists all agreed with each other, we would not be going anywhere. It would mean there's nothing else to do. So they have to disagree with each other, and they have to debate their various positions, carry out additional research, and I think that's happening on a daily basis now.
Before we get into any other questions, I'd like, since this is sponsored by your World Spine Care Initiative, take some time and share with us just what is World Spine Care? What are you trying to accomplish? What have you accomplished? And what's your goals for the next 5 years? Where are you going with this organization?
This is probably the World Spine Care is probably my dream project. When we published the Bone and Joint Decade Task Force on Neck Pain in 2008, and shortly after that, the Global Burden of Disease data came out and was published, showing that back and neck pain were the #1 causes of disability in the world. And having spent time traveling around the world, having been in China, grown up in South Africa, and traveled much in Africa and even South America, able to see the fact that people who were disabled from spine problems in poor neighborhoods or places that were underserved, where there just was no healthcare facilities at all, were just being put in a corner. They were being disabled, put in a corner. Sometimes some charity from around the world would give them a wheelchair, but if you would give them a wheelchair or suggest that they do something, they were basically ignored. The disabled in the world were being ignored. So the question which Joan and I raised is, how can we help these people who are underserved, who are disabled because of spine problems? Spine happened to be my major field of interest. And we were very fortunate. Jeff Outerbridge came on board and went to Botswana. We were funded by a number of agencies to get our first clinic going in Botswana. That expanded eventually to 3 clinics. We then had over 50, almost 60 volunteers from around the world who would travel for various periods from 6 weeks to 2 or 3 years to see patients in these clinics, and they continue to do so. And then there was a more and more people just joined either on a board of directors. They became registered as charities in the UK and Canada as well as the US. And then we started to get some research funding, mostly from the Skoll Foundation and the Musk Foundation and the NCMIC Foundation that you've been involved with. And this increased our ability to look into what can be done, not just providing what care we know about, but how can we actually do research to improve that care in underserved communities? And can we offer a service that's better than it's currently being offered? And what I think is, we're now at our 10-year clinical anniversary. There's a really nice, Nathan has put together a really nice 10-year anniversary of our very first clinics, about 12 years since we actually got this thing off the ground. We're finding that there's a real need. We get requests from all around the world repeatedly, and not just in what one would consider very low income countries. We're getting requests from indigenous communities in North America and in Australia and Brazil and South Africa and so on, which we don't have the resources to fill at this time. What we did get is a very nice grant from the Skoll Foundation to develop the Global Spine Care Initiative. This was an initiative which we had 68 people from 24 countries put together, reviewed the literature, and just gave them and developed a model of care that could be implemented anywhere in the world. And that has become very widely recognized. As a matter of fact, there are now research projects in 2 or 3 places in the world to implement this. And just recently, we've had the ability, we've received funding to open a clinic in northern Manitoba in First Nations community up there, and to do some implementation research and to do implementation and impact, because we had another grant from Skoll 2 years ago to develop an implementation impact study protocols. And Andre Boussier from University of Quebec and Stephen Passmore at University of Manitoba were 2 of the main leaders in this field, and have managed to find the funding to put into this project. Similar projects that we've been approached from Nepal, and the Nepalese Neurosurgical Society has actually asked us to help them develop a nationwide program to improve spine care in the country, as well as a community clinic in a remote area. And as well as, perhaps, if funding becomes available and the resources available, an implementation project. And we've just recently been approached to consider an implementation project in a remote area for Aboriginal Australians. So if this momentum continues, we can anticipate seeing growth of projects in remote areas. And if these implementation projects actually show a significant benefit, because this is not just a charity anymore, this is now actually looking to see if we can develop a better method of managing people with spine disability, then it could become a model which governments may take over, World Health Organization may take over. World Spine Care is already a recognized organization within the World Health Organization as a promising model of care. And we participate, we're hoping to participate in the World Health Organization, World Rehabilitation Alliance. And some of our members are involved in the ongoing World Health Organization task force to look at and establish guidelines for the management of back pain. So it's becoming an international issue. I think it's widely recognized, and although we can't do it all, it would be interesting to be able to continue with that. And hopefully it'll continue to grow. I'm expecting it to.
Scott, I've often drawn the comparison between AIDS and back pain. And back in the 80s, when AIDS was a massive concern for the entire world community, all governments were pouring all kinds of money into research and how we can manage and overcome that plague, if you would call it that. You now in your film has said that back pain and neck pain are now the #1 cause of disability around the world. Shouldn't there be enough social impact from that disability to raise an awareness that every country in the world would want to fund your organization and have you come help them?
Yeah, we would hope so. I have a slide, which I do when I sometimes present, which shows the distribution of research, of charitable funding around the world. And the amount on non-infectious diseases. In other words, if you eliminate infectious diseases, women's health, and child mortality, you end up with like 5% of all charitable healthcare foundation giving. Of that, you can't even, M.Sc and neck and back pain is not even mentioned. So there are no major international foundations for the management of back and neck pain or disability related to back and neck pain. That, however, is changing. And there are a number of things generating that change. The one is that it is now recognized as a major cause of disability. It is also recognized as one of the most expensive expenditures in healthcare budget in the United States. $134 billion is spent every year just on the treatment of back pain, with almost very little impact on the disability that can be measured anyway nationwide. The issue, which is one of the main drivers for further research at this point, is the opioid dependency issue, which is much higher and much more serious in low-income and underserved communities around the world. The opioid dependency, there's one study that is been coming out which shows that communities in the United States where there are no chiropractors or physical therapists have a much higher level of opioid dependency. And there is some of the work, I'm now on two or three different panels to look at opioid dependency and back pain. And what is found that if your first contact clinician, when you get a episode of back or neck pain, is a chiropractor or physical therapist, you're going to have a much lesser likelihood of becoming dependent on opioids than if your first contact clinician is a family physician or a medical physician who generally would prescribe that, having no other. This is not a criticism of them, they just have no other tools to use. So I think that the social issue is becoming very obvious. I hope and anticipate that we'll see a greater emphasis on the management of disability as a whole, but especially back and neck pain related disability, which are by far the dominant causes of disability worldwide.
Given that this is Veterans Day, and in your introductory movie, you've had involvement in advising the veterans concerning chiropractic care. Can you share a little bit of insight on your experience there and what you see happening?
Yeah, it's not been that great, that much. But I did my fellowship at the Long Beach Veterans Administration Medical Center and ran clinics there for a period of time. When chiropractic was being considered for the VA hospital, I was asked to testify before Congress in the United States. And I had been on an advisor to the legislative panel or the panel in the military healthcare system. And so I was basically, in those days, it was before any of this happened, there was a real communication difficulty between chiropractors and medical community, medical physicians. Some was language, some was political, some was historical. And so it was felt that I had the capacity to come in and act as like a translator between the two and basically say, there's a role here. Firstly, the military and the veterans community system, it did not have the facilities or the expertise to help people with spine-related problems. And it's a major, major cause of problems within the veteran community. And that if one instituted a chiropractic program, that this was likely to reduce the impact and create relief, and it was accepted. And now we have chiropractors at virtually every VA facility in the United States.
They are ingrained into the clinical program. They're not just an adjunct. They're part of the staff, and they're also involved in conducting research within the VA. It's been a major change of perspective there.
Yeah.
Someone just flashed a note on my screen that says, please have him mention the Spine 20 initiative. I think that came from Marguerite. Do you know what she's asking there, Scott?
Sorry, who are we talking?
I saw a note come up, said that please have Scott mention the Spine 20 initiative.
Oh, the Global Spine Care Initiative?
I guess that's what it is, yes.
It's Margarita Norden is asking about.
Oh, Margarita's. Hi, Margarita. Yeah, the Global Spine, Margarita has been one of the prime leaders within World Spine Care. She's been in it from the very beginning. She's vice president of the organization, and she has been a supporter, unbelievable supporter. Yeah, the Global Spine Care Initiative has been one of the big initiatives that World Spine Care has been able to get involved with. This was funded by the Skoll Foundation on a grant, and it was 68 clinicians from 24 countries who worked for almost 3 years to review the scientific literature and list all the evidence-based, what the evidence actually showed us is likely to be beneficial in the management of back pain, both pharmaceutically and non-pharmaceutical care and surgical care as well. And then to develop a model which we could introduce into underserved or low-income communities, which will allow a triage of patients so that those patients, one of the things we found, for example, in Botswana and has been found in other places, is that if you go to a spine surgeon office, about 70% of the patients who show up don't require surgery, simply because they have not been triaged appropriately. We also find that too many people get MRI scans and X-rays that have not been shown to be very beneficial and often lead to other expensive investigation and treatment. And we've got a fair amount of evidence on this now. And so the Global Spine Connection put this model of care together, developed a triage set of questions, and for the most probable presentations, gave a flashcard showing the type of treatments that the evidence would suggest could reasonably be offered. And right now it's being tested. There are testing going on, as I said, in northern Manitoba. They're considering it in Nepal. They're considering it in a couple of other places as well. So it's been a very successful movement. We still have a lot of work to do to make sure that it's valid, but hopefully that will happen in the next few years.
Nathan, do you want to direct some of these questions that are coming in?
Yeah, let's go ahead and do that. We'll move over to the Q&A portion of this, and I think we likely will go past the hour. So if you all are willing to stick around, so let's do a few questions, then we'll do the book drawing, and then we can continue on with a few questions. One of the early questions that we got for Dr. Haldeman, Dr. Scott Haldeman, which you've touched on a bit, and a few people have asked something like this. But Dean Smith asks, what are some of the important research questions about chiropractic that you would still like to answer?
Oh, that's a huge number. There are still so many questions that we don't understand. And I think that the separation of chiropractic from spine care should now be put aside. That in fact, chiropractors are part now of a spine care team, which includes physical therapists, orthopedic surgeons, rheumatologists, neurologists, psychologists, and so on. They have very unique skills and very unique training, and I anticipate that they will be incorporated within the healthcare system as a recognized skilled professional increasingly over the next few years. But lots of things we don't know. For example, there's been suggestion by acupuncturists and neurologists and chiropractors and osteopathic physicians that somehow if you manage, if you treat people with spine pain, you can reduce some the impact of some non-musculoskeletal symptoms. We don't know if that's, there's right now no evidence that actually giving an adjustment will help something like diabetes and so on. But if you have somebody who has spine pain and you can reduce their disability, that may have a positive impact on some generalized non-MSK diseases. We don't know, for example, whether one type of manipulative therapy or adjustment does any better than another kind. And we don't know exactly what it is we're treating. If one's giving, we don't even know what the cause of back pain and neck pain is in the majority of patients. Majority of patients present with back and neck pain. If you take an X-ray, they're always abnormal, or MRI scan, there's always degenerative changes, there's bulging, lots of things that occur equally in people with back pain or as those without back pain. And we don't know, and so we're only in the very beginning stages of understanding what a chiropractor does or what any of us do when we're treating somebody with back pain. We have some evidence of what is more likely to be of value, but we don't have the answers.
Another question coming in from Dr. Alex Adorno is simply, Scott, what inspires your drive?
It's exciting. It's fun. It's, you know, I don't play golf. This is my golf. I do this 7 days a week. I always have. It's a challenge. I can't think of anything better. You know, and it's to watch it evolve over time is so important. One part which is of interest, for example, you know, the G20 summit that occurs every year. There's now a Spine 20 summit, which occurs every year. Margareta Nordin is very active in this. I try and participate in a small way. And all of a sudden, you've got these experts from around the world. As a matter of fact, anybody's on this webinar can join and listen to this, these experts, and they're coming up with protocols and that they want the world to recognize, just and push this whole field forward in the right direction. Well, that's exciting. Going to the World Rehabilitation Alliance and participating with others and seeing how people are being helped is exciting. It's not, I don't find it hard to be motivated in this game. I have a much greater difficulty saying no.
If I could add to that, Nathan, another thing that drives Scott is his wife, Joan. You want to comment on that, Scott?
Yeah, this wouldn't. I'm probably the luckiest man in the world from that point of view. Joan and my wife Joan is a physical therapist. We met in high school. We've been married 57 years, and there's nothing in my life that has not been impacted or that I could have achieved without her support, assistance, background, care, loving, and so on. Joan is probably the most important person in my life.
You know, that reminds me of a bit, if I'm recalling from your biography, there's quite a few stories where sort of the resilience of both you and Joan really stuck out. And one is when I think you first arrived to Canada and were moving into an apartment and didn't have a mattress. And so you had to go out and get a mattress, but you also, I think, didn't have a car or jackets or boots. And tell us a little bit more how that went down. I'm probably misremembering some.
Yeah, this is the greatest challenge Joan had. We arrived in Canada. I was on my way to do the Ph.D. in Vancouver, but in order to get a license to practice chiropractic, because we had no money, I had to spend 8 months at CMCC in Toronto, and we looked up somewhere to stay, and the only place we could afford was a basement apartment in a house in the Italian neighborhood, and as I say, we moved in, and Joan had no clothes. It was midwinter, it was January in Toronto, and she had no clothes. She froze to death, had to go to work as a physical therapist to support us. It was really a terrible apartment, and we didn't have a bed. They had a quote bed in there, but the mattress was 100 years old. And so we went, somebody looked up ads, and there was one ad that said a mattress for $5. And so we walked to the place, and there was a mattress. It was one of those that they want you not to buy that one. They were going to switch you to something better. And we looked at the mattress, and it was it had some defects in it, but it was still softer than what we had. And they said, so I said, no, we'll take this $5 mattress. And they said, well, how are you going to take it? And I said, well, where's your car? And he said, we don't have a car. Just put a rope around it and I'll carry it back to our apartment. And so going back to the apartment, the road was slippery as hang, and Joan just couldn't stop laughing all the way back to the apartment as I was slipping with this mattress on my back. But that was the biggest challenge. I eventually bought Joan a car for $60 from a junk shop. They were going to junk it the next day, but it still ran. And the problem is that the floor was rusted right through, and it had no rear window, and it was, I mean, it was ready to be junked. But it lasted for 6 months, and we survived on it. And the stories are very interesting. But that's the type of person I have the fortune of being with.
Well, and there's a great story of when you're in Tanzania as well. I can't quite pull up the photo, but when the vehicles got stuck in the mud, and again, photos and videos of your wife just smiling and having a blast through the toughest of challenges that most people wouldn't enjoy. Samba in Botswana just wants to say thank you from Botswana. So thank you, Samba, for that message. And I'm just going to indulge myself with one more story from the biography because I do want people to feel encouraged to read it. But I was quite impressed by one small anecdote that these popular green books in chiropractic that you read, but not just read, you memorized one while you were in school I think to impress a professor. Maybe Reed can fill in some details as well. But I'm curious about these green books. I've read a couple of them, but do you think that today there's value, whether historical or otherwise, for us to read those books?
Yeah, I think they're historical books. Okay, there isn't a medical text or a scientific text or a chiropractic text that's 50 or 100 years old that one can use as authoritative. They're not authoritative, but they are historical. The interesting part, I haven't counted them recently, but there's well over 20 of these books which were published mostly by B.J. Palmer at the Palmer College on everything from chiropractic gynecology to principles of chiropractic to the adjustment to I think they are interesting to read. I've read parts of most of them, not all of them, I must admit. If you read them, it's interesting to see how the world has changed, but yet some things have stayed the same. One of the things that has always impressed me about the historical background of chiropractic, and for that matter, osteopathy and the other thing, is the natural history approach. When I grew up, for example, my father would not allow us to smoke, we weren't allowed to drink, we had to exercise every day. We were supposed, he said, you got to be happy, you got to do what makes you feel good. So it was, and then you had to have fresh fruit and vegetables every day. And so now I must admit, he liked liver and onions because he thought liver was good for your eyesight, and he had a little problem with his eyesight. And that part of his recommendation kind of fell by the wayside. But the general idea that you can stay healthy by natural means, by having a good diet, good psychosocial component, good exercise, and so on, I think has been so intrinsic within the chiropractic world, more intrinsic in the chiropractic world than in any other of the worlds I've spent time in, that I'm not sure that some of the positive benefits that traditionally chiropractors have found in their patients and what they have been offering them over the years has been a focus on what's called things natural. And I think that chiropractors still have a role to play in a national and international public health forum in stopping smoking, don't excessive drinking, exercise regular, eat what we now call a Mediterranean diet. And so I think that is an issue which is something that chiropractors should not give up.
We'll get to the book raffle in just a moment, but a couple other questions coming in. I think it's Sarah Leal, who is a student and also interested in volunteering, asks, what is the most interesting thing that you have learned recently?
Ooh, that's hard to answer.
Define recent.
Yeah, define recent, define most interesting. There is so much going on. If I spend a lot of time reading the literature, I'm on half a dozen different research projects, and I have the World Spine Care program, and they're all so terribly exciting. I think that if somebody is interested in volunteering, it'll be an unbelievable experience. Every one of our volunteers at every clinic has said that it changed their life, and that it changed how they practice, it changed how they see patients. They see more pathology in 1 week than their entire course in either a chiropractic or physiotherapy school. Because you become the expert, you are the authority in there because you're the only person there. I think if I was young, I would volunteer that would be for me the most exciting and challenging thing I could do as a young physical therapist, a young chiropractor, a young spine care clinician, or young surgeon even, is to go into a remote area and actually see what happens to people and see how you can help people who currently have no access to care.
Reed, you're still writing books and doing some history. What's the most interesting thing that you've learned recently?
Well, I'm in the midst of doing 2 books, one on the history of foot levelers, the other on the history of Western states. In both instances, the origins and the early struggles that either one of these organizations encountered and what the obstacles they had to overcome tells me that we have a great debt of gratitude for these early pioneers who wrestled with hardships and lack of funding, lack of acceptance socially, and yet they carried on. They had a belief and a faith in what they were doing was good and it was helping people. And somehow we need to get that more imbued into our students and our practitioners of today, that what we're doing is worthwhile. And how we do it, there's so many more opportunities now that we're becoming actually a diversified profession as chiropractors. And yet that diversity strengthens our roots and gives us greater opportunities to serve the people that we're here to serve. So I'm encouraged with where this profession is going, and someone like Scott has certainly led the charge and opened doors and broken glass ceilings to help all of us be where we are today.
Well, thank you very much. That's very good. We're reaching the top of the hour, so let's go ahead and see who we can get this book to. Again, I do have a brand new copy here, and what I'm planning to do is sending this off to both Scott, Dr. Haldeman, and Dr. Phillips to have them sign it with the message to whoever wins it. So I've entered everybody who's attending into this wheel. Now, I know we have a few people who are close friends or who may already have the book. So if we pick your name and you do have the book, quickly put it in the chat, and then we'll find a way to pick another name. So let's see who is going to win it. And it is going to be looks like that is Bjorn. Congratulations. I will be reaching out to you via email, and we'll be able to get that book to you. And again, if you're still on the call, let me know if there's any reason you wouldn't want that book. Now, if you didn't win it, you will still, I think you still have a chance to go on Amazon. There are some used copies available. And you can also support World Spine Care at the same time by using Amazon Smile and selecting World Spine Care as your charity of choice. Amazon then donates back a portion of that purchase to World Spine Care at no additional cost to you. I believe this is still only available in the US, but you can probably also find some other copies on other used bookstore sites. I also want to take a moment before we close here to invite you to donate to World Spine Care if you've enjoyed this webinar, this discussion between Dr. Haldeman and Dr. Phillips. Please support the work that we're doing at World Spine Care, and you can do that by going to worldspinecare.org/donate or scanning the code that you see on your screen right there. I'll leave that up for a few minutes. And we will get back to just a couple more Q&A questions before we sign off. But I do want to thank everybody for their time and for joining us here. And I do have a question here from Jennifer in the chat, who's wondering whether we're planning to reopen the clinics in Botswana soon. Scott, you want to answer that?
We haven't. One of the clinics has never closed down. We've been very fortunate to have a young chiropractor in Mufutsi in Botswana. He has stayed there throughout the pandemic. He's continued to look after the clinic, and that clinic remains open. We have 2 new volunteers who are wanting, and we anticipate we'll be going early, perhaps even in January, to open the other 2 clinics. So we expect the Botswana program to be fully open early next year.
Another question coming in from the previous registrants was about, sorry, let me pull up my questions here. A couple of people asked this, and again, you've touched on it a little bit, but because quite a few people asked, Michael Bracchio asks, how do we improve the image of chiropractic in the medical and general communities? And then David Greif asks, what will it take for chiropractic to achieve cultural authority? What thoughts do both of you have on that?
Well, this is up to it depends what the chiropractors want. Chiropractors already have cultural authority in that those chiropractors with a Ph.D. are now participating at major conferences everywhere in the world. They already are part of the discussion. They're part of there's still some problems. One of the biggest issues I was recently asked to talk at a meeting is that there's still a fair amount of diversity within chiropractic, which cannot be, which makes it difficult. Diversity in opinion, diversity in theory, diversity in what is scientific, what is evidence, and what is science, and so on. Some of that is inevitable, but sometimes it's hard to determine what's going to happen to a patient when they go to a chiropractor. And that need a more standardized practice, I believe, would greatly enhance both the reputation and the usage of chiropractic care. And hopefully that will begin happening in many parts of the world. It's already happening. The US is probably the weakest part of the world for that, in that regard.
The term cultural authority was coined by Paul Starr in his book, Social Transformation of American Medicine, published back in 1980. It's become quite a term that's commonly used now, but I'm not sure everybody fully appreciates what it really represents. Chiropractic has achieved much greater level of cultural authority than I had back in 1980. I don't think I had any then. Many things have gone into the mix to make that happen. Legislative actions, lawsuits, education, and most important of all is the research. Like Scott said earlier, he was the first chiropractor to get a PhD in the biological sciences. And Scott, I was a few years behind you, but I think I was number 5. And you could put all the chiropractic researchers who are trained to do research in a phone booth. And now, as he mentioned, I'm trying to compile a list, and I do have over 125 people with DC degrees and advanced master's or PhD degrees. So we're building a cohort to do the work that needs to be done upon which the cultural authority rests. But we also need to also be involved in legislative activities and just make our footprint felt by being good citizens and doing good work and continuing to serve the patients that we serve. It's coming, and it's going to come more faster and more as time goes on.
Let's have one other question here. From a member of the audience, Pavan asks, what advice would you give your younger self?
Oh, get excited. Read, attend meetings, participate, be involved, have a practice, enjoy seeing your patients. There's so much opportunity now. A young chiropractic graduate can do virtually anything. Can go work for the VA, can go work for a multidisciplinary clinic, can go into private practice, can go and do master's, advanced education, can do research, can go into politics and do legal stuff. Find what you want to do. It is unlimited. So whatever turns you on, you can get it now. There was a time when we were young when you had no choice. You either went into private practice or basically you went into private practice.
Or you went to school and taught.
Yeah, you could. The best you could do is teach at a college, one of the chiropractic colleges, if you had a bit more ambition. But these days, there's no limit. You just have to. You just have to decide what you want to do and be part of it. This is a big community now, and everybody is invited in. World Spine Care invites everybody to participate. Anybody can go to a Ph.D. in advanced education in any field they want to now. There's no discrimination about getting you into even the very best. We have there are people young chiropractors who are working at Harvard, at Yale, Stanford. There's no barriers anymore.
Nathan, when I started in practice, I had a good friend who was a local orthopedic surgeon. And I was lamenting to him one day when we're having lunch together, how limited I am in my ability to practice as a chiropractor. And he looked at me and kind of scratched his head and he says, I don't understand that. He says, I'm a surgeon and I work exclusively on disc problems in the low back. And he put his fingers together like this and he says, that's the area of my practice. He says, you treat the whole body, the whole person. So don't cry to me about being limited. And he totally changed my perspective on what chiropractic is all about.
And I do enjoy Scott's, there's a quote in the book about how spine is one of the most interesting, probably the most interesting organ. It involves all sorts of the body systems. It is certainly interesting. And you were very involved in many different organizations, as we saw in the video and reading your bio. And I only read, by the way, a very small portion of your biography. People can read the full thing on our website. Talk a bit about the importance of being involved in associations, societies, conferences, because it is a cost. It's time away from practice. But what do you gain from that?
In this day and age, there's so much, I don't want to say conflict, but disagreement. There's so many areas where different forces are moving in different directions. And the one thing I never appreciate is a chiropractor coming to me and saying, why don't you do X, Y, and Z? Apply, go to the government, go to the veterans, go to the military, it's not my job to do that. My job is to do what I want to do. And and all of those things are available. If you're not a member of one of your major associations, you can't complain if the system's not treating you right. This is a political world. And politics are intrinsic in the privileges that any single individual has in their professions, in their occupations, and so on. So I believe very strongly that all healthcare professionals should be a member of their national state association, should be active in it. If you're not political in nature, you should maybe go to something like World Spine Care or World Federation or some of the research society. If you want to do research, you should be active in, and only when a substantial portion of a profession is active in the political, scientific, and community world that influences their practice and their patients, can that field benefit, and can it be exciting? That's what's exciting about this whole game.
There's an axiom that goes, the world is run by people who show up at meetings.
Yeah. I got to tell you my best example of that, if we have a minute. When the NCDS, when I was invited from Vancouver I was a third-year medical student, and I'd in class one day, the next day I'd be at NIH headquarters with senior people, and the first meeting came up, and they said none of them knew what this whole meeting was. They were invited there, they were told they had to be there, but none of them had any idea or particular interest. So we had this meeting, and everybody brought up a few points. And then Murray Goldstein said, why don't you go at the next meeting, you come back with some ideas of who should speak and how the conference should be run. So I went back, I got all the great names, Alf Nachemson, Kakaldi Willis, Syriacs, all the great names in spine care. And I drew out a whole program for this meeting. And I thought, oh, nobody's going to listen to me. I'm just this kid. And I arrived there, and I was the only one who had put anything down on paper. I handed this to Murray Goldstein. He said, oh, this is a good starting point. And he opened it, and they accepted 80%. They had some great ideas. They knew people, who would fill in certain places better than I did. But they accepted 80% of the program that was there. And that's when I realized the impact a single person, even a young person in their 20s, can have on at a major policy meeting.
Great story.
Yeah.
Well, thank you both again for your time today, and thank everyone for participating and joining us for this great discussion. Dr. Phillips, is there somewhere people can follow you to get updates on your next books that are coming out?
I don't keep a webpage, so you can share my email with them, or they can those books are not going to, the Foot Lovers book will come out next year, and it'll be 2 years before the Western States book comes out.
And will those be published just at those organizations, or will
through
those
those
be
organizations
publicly available?
Yes. Yeah.
Okay.
And we just
So
finished
we'll,
one on NCMIC. You can contact them. They have one that we just did.
Great. All right. Well, thank you again very much for your time and for leading us in this discussion with Dr. Haldeman. Anything either of you want to mention before we sign off?
Thanks for doing this.
It's a real pleasure, and it's an honor. I appreciate everybody who joined up to listen to us. Many are friends, close friends for many, many years. Thank you all.
Honor's ours. And again, if you'd like to learn more about World Spine Care, head to worldspinecare.org, where you can learn about volunteering or getting involved, even if it's not a clinical role, and you can make a donation as well. We'd like to leave you with a short video that we've prepared about the everything that World Spine Care has accomplished over the past 10 years since the first clinic was opened. So again, thank you very much for joining us on this webinar, and we hope to see you again soon.
It's been 10 years.
10 years.
10 years.
It's been 10 years since the first World Spine Care clinic opened in the Manipulative district of Botswana. Hooray.
Since then, we've opened 6 clinics in 4 countries.
Botswana,
The Dominican Republic, Ghana,
and India. Since 2011, more than 60 volunteers
60 volunteers.
60 volunteers.
More than 60 volunteers have volunteered to provide spine care in underserved communities.
For 6 weeks and up to years at a time.
Through the World Spine Care clinics, more than 50,000
treatments
have been provided to patients around the world. Each patient has a story.
a story that is about so much more than back pain.
A story about family,
community.
Government,
a nation.
A story about a world overcoming the burden of disability from spinal pain.
These stories give us a glimpse of our vision of a world in which everyone
everyone.
Everyone has access to the highest quality spine care possible.
Over the past 10 years, World Spine Care has pursued our mission to improve lives in underserved communities.
And we've been able to do it because of people like you.
People like you, healthcare providers who understand the urgent need to provide sustainable, integrated, evidence-based spine care
to the people most in need. Join us.
Please join us.
Help World Spine Care continue to provide quality care to the over 1 billion.
1 billion.
Over 1 billion people with spine pain around the world.
Donate today to support our efforts
to make spine care accessible to the people who need it the most. Thank you.
Thank you.